So I'm Dr. Molly Force, and I'm the clinical director here at Prosper Natural Health. And I'm joined today by Dr. Mary. And we also have Dr. Rosalie as well, who works with us. And we provide a team care approach to natural medicine and to primary care with our patients. And today we're going to be talking, of course, about pain. And this is a very, very big topic. We want to make sure you guys all walk away with some really useful information. So we're going to ask that you keep your questions and put them in the chat area so that we can be going through those at the end. But we don't want you to miss out on anything. This is really your time. It's supposed to be something that you guys walk away with some really good information from. So our goals today is to go over what different types of pain are. Specifically, we're going to be talking about chronic pain. We also want you to have a good understanding of how we can evaluate and monitor pain levels. And then we also want to, of course, have you guys walk away with tangible things that you can do to help you with pain management. All of us throughout our life experience pain. It's a very rare condition that somebody doesn't have the ability to feel pain. And in those situations, those babies actually don't survive. Pain is a very important mechanism. It helps us with survival. It helps us to understand when our tissues are at risk or being damaged. So it's actually a very important part of our physiology. Now, of course, an imbalance of this pain can be all-encompassing. It can absolutely destroy your day or week or month or even year if pain is out of control. So there is this model of hypersensitization, and we want to go through that with you today. And this is where the biochemistry really starts to come in. So we wanted to give you guys this model so you can refer back to it, and just so you can kind of start to wrap your heads around how very complex this is. But the kind of takeaway here is that we have this insult, if you can see my cursor here, this inflammatory insult that happens to the person's body. And then we have this huge set of chemical reactions that happen after that. And in this process, we have all of these signaling agents, these neurochemical signaling agents that provide this peripheral, which means on the outside, right, sensitization. And then there's messaging that goes from the peripheral to the central nervous system. So here we have it going to the spinal cord. And then these nerve bundles provide the information to go up to the brain, and we can see this activation of these glial cells within inside the brain and these astrocytes within inside the brain. So this is the communication from the outside in of what is happening with pain, and then we perceive it as pain. Now, what can happen with this pain perception is sometimes these pathways become incredibly effective, too effective, in fact. And so once we have high levels of these inflammatory, you can see these interleukins and this TNF alpha, once we have these inflammatory chemicals flooding the system, it can be very easy to trigger pain from less of a stimulus. So that sets up a very challenging cycle for us when we're dealing with pain management. Now, if we take a step back and think about the main mechanisms of pain, we have these chemical mediators that we were just discussing. We also have brain function. So the brain is going to help with promotion of these signals and inhibition of these signals. So there's inhibitory pathways that run down that spinal cord out to the peripheral, just as we have the information coming in from the peripheral to the central nervous system. We also know that certain moods can, for example, depression can affect with our brain function can affect our perception of pain. We know that when we have depression, our perception of pain increases. And we know that neural inflammation, so we saw those glial cells on that last slide. So we know that whenever the brain is dealing with inflammation, then there are more of those inflammatory compounds and we have higher activation of pain. We also know another major mediator happens with sleep. Sleep is our master reset that happens, and it's supposed to be happening in this cyclic every 24 hours. And that is a major portion of how our body manages and deals with pain. Now, of course, you might be thinking, well, shoot, my pain is actually keeping me from getting that sleep. And we're gonna talk more about that today. But that is an absolute challenging cycle for managing pain. So there are these different types of pain syndromes. We have what we consider active pain syndromes, and then we have what we consider these sensitization syndromes. Now, with the active pain syndromes, these are often what we're thinking of having tissue damage, so trauma or an injury. We also see this with autoimmunity, where the tissues have been attacked and are degenerating because of that immune attack of self. We see this in degenerative joint conditions like osteoarthritis, where the joints have wear and tear. We see this for migraines, and there are different metabolic conditions, like we think of diabetes with peripheral neuropathy, where there's these active pain sensations that go on. Now, the pain sensitization syndromes happen from, remember that first slide, where we have these chemical mediators and we have this neurotransmitter signaling that's inappropriate. It becomes this easy trigger, easy button trigger for the body, a very well-learned path. So this is where we start to have phantom pains. This is the category that fibromyalgia fits into. This is the category that we see post-brain injury because of this neural inflammation that happens. And we often see it post-surgery if there's a problem with the surgical repair as well. So we wanted to differentiate those for you guys because depending on what category your pain is coming from, or maybe even categories, that affects how we address this from a physiologic standpoint, and especially from a natural standpoint. So this gets into some more technical terms, but we wanted to just kind of list out for you some of the most common chemical mediators, because a lot of times when we're talking about how we manage pain, we're thinking about how to manage that physiology and how to really affect those chemical mediators. So some of the things that we're going to talk about today that might be a little bit different from the common discussion of pain control has to do with mitochondrial dysfunction. Now we're going to get into the nitty-gritty of what the mitochondria do, how they're the powerhouse of the cell, and how they can become disorganized in their function, and then we don't have proper cellular energy here in a minute. But the important part to know right now is that chronic pain can happen from cellular damage and failure of the cells to make these proper chemical mediators. It can also happen from oxidative damage, where you have damage to the cells. We call it free radical damage. We know that these inflammatory cytokines, like we saw on that first page, are going to bump up the pain because those are the pain signalers, right? We know that histamines do this as well. So we see this with allergies, like, oh, my eyes are hurting and they're itchy and red from an allergic response. It's that histamine packets being released by our mast cells. Free radicals will cause that oxidative damage. So those might come in as external chemicals or sources of damage, or even things like UV light. Low oxygen, we know, can cause damage to those cells, and that can be part of our pain syndromes. Blood sugar dysregulation absolutely can feed in to pain, and we'll talk about how that's related with cortisol. Adipokines, as well as different hormonal stress signalers like catecholamines and other signalers like substance P, which kind of stands for pain here, will affect these inflammatory responses and these pain responses. And we know that different microbiome metabolites, so here we're circling all the way back to our microbiome and the flora that lives symbiotically with us, that can also affect our pain and our pain signaling. So when we think of different pain levels and our body's ability to have energy as a host body, we think about people with really a lot of energy, generally having very active, healthy brains. They have the ability to do what they need to do, get through the day with their tasks, be very active, and recover quickly, okay? They have a decreased risk of disease here. As we notice the energy slowing or decreasing here, that's where we start to get into these fatigue syndromes, difficulty with pain management. Oftentimes mood disorders come in here. We can have neurodegenerative problems, cancer, cardiovascular risk goes up. So we see this energy slide, and the reason we wanted to mention this is because it's so tied in with pain. When the energy breakdown happens and we don't have the ability for our cells to be producing ATP, which is our energy, cellular communication of energy, our energy packets for the cells made by our mitochondria, we start to see these different categories of fatigue. So thinking about that energy slide there, it starts being intermittent fatigue, and then it slides into more chronic, and then we have chronic illness, okay? So mitochondria, I promised we would talk about it. That's that powerhouse of the cell. It's pretty cool looking at how humans developed mitochondria and animals developed mitochondria, but that's a whole nother discussion. We kind of get into some of that during our fatigue talk that we did pretty recently, if you guys want to check it out on our website. Here we are thinking about ways to support energy production at the cellular level. So we know we require either glucose or ketones. You guys have heard of the keto diet, right? So either we're requiring these carbohydrates in the simplest form, glucose, or ketones and oxygen. And that helps this cellular metabolic pathway to happen in combination with certain nutrient cofactors. You can see them listed there, lots of B vitamins, alpha lipoic acid, carnitine, a few of our antioxidants here with vitamin C, and we've got magnesium, calcium, and vitamin K as well as antioxidants. All of these combined help the mitochondria make our ATP. We can have either activation of the cellular pathway with better energy and less pain, or we can have disruption of this pathway. That might be because there's not enough cofactors going on. We might not be getting the right precursors if we're dealing with metabolism issues, for example, in diabetes, or even dysglycemia, where we're having hypoglycemia and we're saying, oh, my blood sugar's too low, I'm getting crabby. Well, we're not having enough of those precursors to go in to make that mitochondria work. And then we know our antioxidants in the glutathione realm protect the mitochondria. So that helps reduce the disruption that can happen. So if we have these physical things that happen to our body that contribute to pain, that hurt us, in that process, we go through depleting mitochondria, which is why we so often see pain being a very exhausting thing for our patients. In fact, a lot of times people don't know how exhausting pain is for the body until they get that pain relieved. And then they're like, oh my gosh, I couldn't really function. I was so tired. It can be very exhausting for the body. So there are some major categories of things that can really contribute to those pains. And so it's important to think about this, because when we're thinking about treating root cause with you guys as our patients, we're really trying to figure out what we can do to affect any future damage from happening and what we can help do to correct the damage that's been done. So we want to make sure that there's not viral infections, specifically chronic viral infections that are just tanking the system. We want to make sure that there's not, if there's tissue trauma that's happened, we want to do our best to mitigate that. Organ diseases, of course, we want to make sure we're not dealing with something like diabetes, which is going to have a big effect on our kidneys in particular and our cardiovascular system. Hypertension, also cardiovascular system, cardiovascular disease in general is going to be a problem for pain levels. And then sleep apnea is another big issue for handling pain. Of course, there's also this category of autoimmune diseases. We've already talked about how those autoimmune diseases are going to cause a tissue attack on the body, and that's going to be problematic. And then certain pharmaceuticals, and we list that one because there are common pharmaceuticals, for example, statins, that have a place. They're important for some people, especially if we have familial blood lipids that are too high, so cholesterol that's too high. And we may need statins, but statins decrease our ability to absorb or create actually CoQ10. So what that does is it affects our ability to make ATP because it affects our mitochondrial function. So if we can't make that energy, we might have side effects, for example, from those statins, like really bad muscle aches and cramps and pains. And that is because we're not having our mitochondria function correctly. So I'm going to pass it over to Dr. Mary here.
Thank you, Dr. Molly. All right, so we're going to continue on with discussing some of the underlying causes or the potential underlying causes of chronic pain that we're often seeing and looking at in our practice. So here I'm going to discuss the hormonal influences on pain and how these chemical messengers that are floating in our body are affecting our perception of pain. So here we have estrogen and progesterone can play a large role. So we often see that after menopause, women will experience an increase in pain and arthritis. And this may be due to the anti-inflammatory effect of estrogen. So it's always something we think about when we're considering, we'll always have hormone levels in the back of our minds when someone has pain, particularly when it gets worse postmenopausally. We also will often see a connection with progesterone and certain pain conditions, particularly migraines and body pains and headaches. Often when progesterone is low, that can play a big role. And then of course there's other pain conditions like endometriosis, where these hormones are kind of playing a central role in that pain pattern. So there's these other two hormones, cortisol and melatonin, that really are responsible for our wake and sleep cycles. And as Dr. Molly was describing, sleep is essential, is an essential piece of pain management, and when we really want to get on board when anyone's having chronic pain. And part of that is because when we sleep, is when the kind of garbage system of our brains and nervous system is doing its job. It's called the glymphatic system. And it's going through and cleaning all of, our cerebrospinal fluid and everything that bathes our nerves. And that can play a really big role in allowing the brain to regulate pain effectively when we have too much toxin buildup and too many inflammatory influences in the central nervous system that can really impact our brain's ability to dampen that pain perception response and to slow it down. So next I'm going to talk about cortisol and melatonin and how they can affect pain. So cortisol, we talk about it in every doc talk because it can be such a kind of overlooked and central piece of a lot of conditions that folks come in with. And it is considered the stress hormone. It has an anti-inflammatory response. So this is something that we really want to keep in balance. The anti-inflammatory response actually can be really helpful for our physiology. And sometimes when we have an inflammatory condition causing pain, when cortisol is too low, we'll have an increase in that pain because we're not getting that anti-inflammatory response. We also don't want cortisol to be too high because this can enhance anxiety, it can change our blood sugar regulation, it can affect our sleep, which then can majorly affect our pain perception. So we really want it to be in balance, and we'll discuss that a little bit later when it comes to our, testing and how we treat it. So the other major wake and sleep cycle pattern that we want to look at, or hormone that we want to look at, is melatonin. So this is our sleep hormone. It's secreted by our pineal gland in the brain, and that comes on board in the evening. So you can see down to the left here, we have cortisol coming on board in the morning and helping us have that full wake response with response to light. And then we have it slowly declining throughout the day. And then around the time it gets dark, our natural sleep response will release melatonin that will allow us to then fall asleep at an appropriate time. So again, this maintaining this proper balance between our yin and yang and our, cortisol and melatonin allows us to get a stay on schedule and have enough sleep, which is an essential component of when we're talking about pain. So next, we're going to talk about different ways that we evaluate pain. And first, we'll start with just the history taking and looking at symptoms. So we'll, throughout this process, want to look at physical symptoms, and we'll want to look at biochemical symptoms, and also emotional symptoms can play a big role. And we'll flesh that out a little bit more in the next slide. So the physical symptoms that we want to look at, often will just be, kind of location, where you're experiencing the pain, and if there's any history of injury, infection. Diabetes is a big one. We want to pay attention to blood sugar regulation and reduce the risk of diabetes long term, because that can lead to painful conditions like a peripheral neuropathy in the hands and feet and things of that nature. We also want to look at our organs, particularly our liver and kidneys, and certain diseases that can cause abdominal pain, chronic abdominal pain. We'll want to look at any nerve disorders. Again, things like a peripheral neuropathy and systemic nerve conditions can cause chronic pain sensitization as well. Autoimmunity is a big one when it comes to chronic pain. That includes things like rheumatoid arthritis, Crohn's disease, which can cause chronic abdominal pain. So that's kind of always in the back of our minds, looking for autoimmune, so undiagnosed autoimmune causes of that pain. And then fibromyalgia, it's debatable whether or not that's related to tissue damage or other factors, but fibromyalgia is a big one, and that comes back to that that hypersensitivity that we were discussing before. So that process by which our bodies are continuing to respond to pain after there's no injury that's present. And while it is something that's happening in the central nervous system, and you are responding to pain more drastically than others would to the same stimulus, there is a physiological basis to why it's happening. And that's important. A lot of times when we say it's originating in your brain, people will say, oh, it's all in your head. My doctors think I'm crazy. But the really understanding the physiology of it can help kind of normalize it and understand that it is the physical process that we can work with, rather than it just being this kind of black box. It's like mental issues. Okay, moving on. There's many biochemical factors that can influence pain. Dr. Molly was talking about pharmaceuticals before. Alcohol is a big one. So whether it's affecting our blood sugar, causing dehydration, and kind of affecting our liver function, that's a one to look at if you're in chronic musculoskeletal pain specifically. Hormone changes, being too sedentary. We definitely need exercise to give us endorphins and opioids that we produce in our own body to help dampen that pain response. Oxidative stress we'll go into a lot more later. That can play a major role. So we need to support our natural antioxidant systems to prevent that recurrent pain sensitization and nerve sensitization. And then lastly, a major piece is the anxiety and emotional response. So we know that the amygdala can be involved in that kind of pain, in sort of deepening the grooves of our pain response and associations. And as Dr. Molly was mentioning before, depression can be a major factor when it comes to the brain adequately responding to pain. So we always want to take that into account and address that as we need to help people stop that pain cycle. So, the fibromyalgia can be it's a very common condition that can cause major disruption in people's lives. And there's some interesting there's a combination of pain and then a number of interesting symptoms that can also be present. So we'll often see this kind of constant dull pain at very specific points in the body, that can often not really have any rhyme or reason, based on musculoskeletal tension or tissue injury. We'll see tingling in our hands, stiffness, headaches, and weight gain. So those are things to kind of look out for and think about if you're thinking you might have fibromyalgia. All right, so next we're going to talk through other ways to evaluate pain. Physical exam and imaging can be key. So we're often just really evaluating the joints, looking at any signs of arthritic changes in the joints, looking for any signs of infection or injury. And then we'll often order imaging if necessary. And that will just allow us to get a kind of more acute understanding of if there's damage going on in a joint, for instance, and to what extent has the damage progressed, and allows us to kind of see where to start. So blood work can play a big role when it comes to evaluating pain, and this is largely when we're looking at systemic causes of the pain response, and a lot of those sort of more diffuse underlying causes, that or kind of global underlying causes that we were discussing before, can be picked up with these different kinds of blood work. So we'll often, so you can refer back to that later as a reference, but generally what we'll be looking at is looking for signs of infection, looking for signs of organ failure, damage, looking for and looking at our nutrient stores. So, we'll look at our iron panel, vitamin D, making sure that we've got all of the nutrition we need to help have a balanced pain response. And then again, things like magnesium and phosphorus can also be really helpful. And then a big piece that we'll look at is inflammatory markers. So we'll want to look at things like the SED rate and CRP. Those look at our systemic inflammatory response. And then, and that is really when we're considering autoimmunity as one of our main causes of the pain condition. And then our ANA is going to really help us flag whether or not autoimmunity is present. And then we have a whole host of tests from there that allow us to really differentiate which autoimmune process is happening, or maybe multiple autoimmune processes are happening at the same time. All right, so, and a lot of these tests are included in our basic wellness panel. I love running this because it's a really great price, and it allows us to look at a really wide variety of markers that can help us look at our holistic health and kind of just get a baseline on a yearly basis to kind of track those markers over time. All right, so before we were discussing cortisol, and this is another one that we really like to run when there's a chronic pain condition happening. And for all those reasons I discussed, we want to keep cortisol in balance and to allow us to have that anti-inflammatory effect and to give us proper energy and sleep patterns. So we'll test cortisol levels throughout the day, starting in the morning, and then we'll also check it midday, later in the day, and then right before bed, and see if that pattern is present of the elevated cortisol in the morning and then slow decline throughout the day. And also we'll see if there's a dysregulation. Is it doing the complete opposite? And is that leading to sleep dysregulation? And do we have enough cortisol to kind of keep our immune system in check? All right, so another thing we'll want to consider is assessing for alternate causes or alternate biological causes of pain, and we'll discuss that in a bit here. So at Prosper, we offer a wider variety of testing than you'll see in the conventional medical system. And this allows us to get really specific about what's causing pain specifically, in addition to many kind of global holistic problems that patients might be experiencing. So we've got allergen profiles and food sensitivity profiles. This can play a really big role when we're seeing someone that kind of has a major histamine or allergic response or a major inflammatory response. And we're really trying to find out what on a daily basis is causing this, what exposures to things you're allergic to, what things are you eating on a daily basis that might be contributing to this inflammatory pattern. Toxic chemicals can particularly affect the nervous system and nerve conduction. Things like mercury and lead can play a big role. So that's something we'll often look into, as a later down the line when we're really trying to dig and find the root cause of what's going on. We'll look at stool pathogen profiles. The integrity of our intestines and our microbiome and our gut function is pretty key when it comes to regulating inflammatory responses and kind of addressing our gut-brain interactions, which can play a really big role in affecting our nervous system and pain response. So it's always something we're thinking about. We can assess the blood-brain barrier and whether or not we have adequate fences, if you will, between our blood and our brain, which again, we really want to protect our brain, and that can affect the nervous system function and our perception of pain over time. And that blood-brain barrier can, in a lot of conditions, become leaky or not have as much integrity as we want. And that's something we can look at to affect our brain function as well. All right,
Today
so
we want
next
to
we're going
make
to get into some health hacks, and Dr. Molly will take us off.
perfect. We want to make sure that we really, provide you guys with information that's useful. So as far as things that you can be doing to help you with pain, we've divided this into some of the basic categories, and then we're going to dive a little bit deeper into some of the nutraceuticals and herbal medicine and supplements today, as well as acupuncture. So the first thing that has to be really tackled is sleep. And we talked about that earlier, about how important it is for pain management. And really, the general guidelines are 7 to 9 hours. And we discuss that with our patients as individuals to determine what's going to be best for them, but making sure that you have a proper sleep hygiene. So starting with some of those basics there, if you're dealing with sleep disruption, looking at some of the causes in your external environment that might be contributing. Maybe you have a partner who's really restless or snores that's near you, and making sure you're doing everything you can to really prioritize sleep. So that means keeping your schedule, setting a routine, really investing in good quality sleep gear. So that means your pillow and your bed. If you haven't gotten a new bed or thought about that in the last 20 years, it might be time. If you're dealing with pain that's musculoskeletal at night, that's keeping you awake or is waking you up, you might want to be thinking about propping pillows. There's so many good tools out there, and we're happy to talk to you about those. We also know that things like stimulants, of course, caffeine, chocolate, those kind of things in the late afternoon and evening can be really problematic for people. We want to do everything we can to really engage in that healthy sleep. So the routine piece is probably one of the most tricky. Now, remember, this sleep is going to be affecting your cortisol levels. And because cortisol, as Dr. Mary was describing, is a inflammatory modulator that affects our pain, we really want to be able to use our routine to set our diurnal rhythm and get the appropriate amount of cortisol when we need it, and get the melatonin to kick in when the cortisol is done for the day. So making sure that you're following your rhythm, so paying attention to our lunar cycles and our sun cycles, trying to make your food intake be at the height of the day rather than really late at night, for example. Making sure we're incorporating that regular movement as part of that daily routine, having a certain time set for bedtime and wake time. This is just something we want to include to just chat about quickly, because it's just the chemical breakdown of neurotransmitters and building blocks that are required for our production of that melatonin. And you're going to see that we have things like our adrenaline starting agent here, and we have tryptophan, which we find it's an amino acid we find in turkey, as building blocks here for our daytime cycle and our nighttime cycle. And the takeaway here is not just how do we build melatonin, but in that process we're also building serotonin, which is our happy hormone. So without proper sleep and without proper melatonin, we're at much higher risk of developing things like anxiety and depression. So another huge factor that cannot be ignored, and is actually probably one of the strongest when you look at the medical literature, ways to mitigate pain and to reduce pain, is through physical movement, through exercise. Now, that might literally be having somebody else move your body for you if you're in extreme pain. So a lot of these studies, they'll have people being in water, like whether it's bathtub or or in a pool and have other people move them and go through the range of motions for these patients. And we find that just physically having our limbs moved and our body moving helps with our sensitization and helps with our pain response. So even though it's easy to gloss over and we can't just give it to you in a pill, this is foundational for pain. So if you're dealing with pain, we want to make sure that you have a plan in place for movement. Tied into that for a lot of our patients is body work with massage, where people are moving your limbs for you and moving the lactic acid out of those muscles as well. So generally, we know that movement can be done in a gym and can be all about, fitness and getting strong, but just the day-to-day movements of walking around, getting dressed, cleaning your house, those kind of things are important movements too. So adding in some gentle stretching if you can, and really discuss it with us or your healthcare practitioners and come up with a good plan for your movement, because it will make an impact on your pain. We're going to talk about diet next. Dr. Mary is going to take it away.
All right. So some of the major goals that we'll want to address with diet is managing our blood sugar. In the kind of long-term effects of dysregulated blood sugar can lead to a lot of these pain conditions we were talking about. So in that, we want to eat a good serving of healthy fats and proteins with each meal, and then avoid high amounts of refined carbohydrates. Want to avoid high amounts of sugar, and especially things like white bread and things of that nature. We really want to stay hydrated. That's key for kind of having our muscles in good shape and allowing our for the kind of flushing of toxins from our system. And then we'll really want to focus on an anti-inflammatory diet, and we'll discuss more on what that means as we go through the dietary strategies. So omega-3 fatty acids can play a really big role in our anti-inflammatory diet. And they are a type of fatty acid that when we eat them, they'll be incorporated into our cells. And then when we go to have an inflammatory response to any kind of signal, the presence of those fatty acids will provide for a less intense inflammatory response than it does when there's other fatty acids involved, like omega-6s and omega-9s. And so we really kind of want to focus on that omega-3 to omega-6 ratio being really high. So some of the ways you can do that are adding fish oils and marine lipids to your daily supplement regimen. And you can also eat things like salmon and sardines on a regular basis. We also see omega-3s and things like chia seeds and flax seeds. So I'm often recommending that on a daily basis as well. And then you really, in terms of incorporating healthy fats in your diet, you want to focus on extra virgin olive oil, unrefined flax oil, coconut oil, and then butter from unpasteurized milk from pasture-raised cows. So you want to pay attention to the sources of the dairy when you are using that as a fat on a daily basis. Another key component of the anti-inflammatory diet is including antioxidants. So these tend to be colorful. So we say if you're eating the rainbow, you are likely getting enough antioxidants in your diet. And the things that we'll look at are things like beta carotene, lutein. As you can see, there's a host of antioxidants, and it can be as simple as eating a couple of brightly colored foods with each meal to get a variety of these antioxidants in your diet. We also want to be sure to recommend the cruciferous vegetables. So those include things like broccoli, cabbage, bok choy, kale. They're all, in the same plant family, and they contain high amounts um, of this substance that provides for selenium, which helps us regenerate glutathione. And it can be really helpful to have that in your diet as really great sources of antioxidants that are going to help quench free radicals and help with cellular regeneration. So the so the things that so that's another easy thing you can incorporate on a daily basis that I really like to recommend with patients. All right. So the other thing that I mentioned briefly before that we really don't want to overlook is is our gut health. So we really want to focus on our microbiome, making sure that we're getting um, enough fiber to feed our microbiome. We want to get healthy probiotics, whether that's in supplement or food form, through fermented foods on a daily basis. And then we really want to just pay attention to our gut as our second brain, and how it's affecting our nervous system and pain perception. So if you are having bloating or noticing you're sensitive to dairy or anything like that, you want to talk to your doctor about it so that you can incorporate that into a holistic pain management strategy.
So we're going to talk about nutraceuticals and supplements next. It's really a very broad category when we say pain, of course. So it's important to be thinking about what your causes are and what areas might be supportive of you when you're thinking about matching these for yourself. We wanted to make sure we talked about the antioxidants because they're so important for that mitochondrial support, like we talked about with that good old energy slide picture that we talked about. And we want to talk about also some specific pain modulators. We're going to talk about COX-2 inhibition and also some analgesics that help reduce those neurochemical pain pathways. So here at Prosper, we have a physician grade apothecary available for you guys. What we love about it is Dr. Mary and Dr. Rosalie and myself have curated all of these products to make sure that they are really good quality and are what they say they are, and they're coming direct from manufacturer. So we know that our patients are getting viable medications here. So as far as when we're thinking about fibromyalgia, it's such a big group of our patients that have it. We wanted to just, before we dive into these different categories, just mention that all of these different nutraceuticals have been shown in the literature, in the medical literature, to support our fibromyalgia patients. So melatonin, we talk about the sleep piece, making sure we're really engaging in a healthy sleep cycle, and that's going to reduce that cortisol as well. Vitamin D has been shown, magnesium has been shown. Remember, that helps relax the muscles. Those omega-3s, which Dr. Mary was just talking about, those being so anti-inflammatory, and curcumin, which we're going to discover is one of our COX-2 inhibitors, very powerful for both inflammation and as an antioxidant. So let's talk more about antioxidants. One of the strongest one we have available to us is turmeric extract. You can just imagine that vivid orange color, right, in the root. So, or in kind of like in curries and foods like that. When we're thinking about turmeric in regards for pain, we're really thinking about it being an antioxidant, which is protecting that mitochondria, but also as a COX-2 inhibitor. Now, COX-2 is part of our pain pathway. It's a name of a chemical pathway that happens when pain is induced. So we can reduce that. It's the same chemical pathway that happens to be blocked by ibuprofen, which many of you guys know that medication. So it's very powerful pain modulator and inflammatory blocker. So when we're thinking about other antioxidants, We cannot forget to mention sulforaphane, which is found from broccoli seed extract. It's actually our strongest antioxidant that's documented. We also love resveratrol, which is found in the skin of grapes, and we find it in wine. So it's been a lot of traction in the news about how wine is a strong antioxidant, and that's because of resveratrol. So all of those should be on board somewhere, whether it's in your diet or through supplementation, generally when we're talking to our pain patients. Now, with mitochondrial specific antioxidants, remember when we were going through how the mitochondria works to build the ATP, and we were talking about glutathione. This is one of our favorite glutathione products that we use quite a bit with our patients. And glutathione is known to pass through the blood-brain barrier and can help with neural inflammation in that regard too, because it's such a strong antioxidant. We can't forget turmeric again, because we know that that is a specific mitochondrial antioxidant, sulforaphane and resveratrol, which we just talked about. This is one of our go-to sulforaphane products called Broncho Protect. Just wanted to point these things out, not saying that they're appropriate for you guys as individuals, but just want to kind of broaden your horizons to them. Now, mitochondrial fuel, which we talked about as well, has been very well established once again within the scientific literature. And we see D-ribose being one of the biggest fuel sources that directly helps as a precursor for our mitochondria. And we also know that these cofactors, like we went over before, are very important. And we have certain supplements we use with our patients that are a combination of several of these cofactors, as well as just using D-ribose alone. Now, when we're thinking that there's an issue with that sleep and cortisol cycle, okay, then we're often wanting to talk to our patients about stress management, of course, is a foundational thing. But when we're looking for supportive supplements and herbs, we often will look at adaptogens. Now, adaptogens are known to help modulate our cortisol levels appropriately, either bringing them up or bringing them down. And we use several different herbal combinations for this. Adaptocrine and HPA Adapt and Adrenal are probably our top 3 that we're choosing for patients. They often will include certain B vitamin complexes within them. Oftentimes there'll be some vitamin C because we know that's important for our adrenals. And these adaptogenic herbs like ashwagandha, for example, rhodiola may be in there, and the different ginsengs as well. So let's loop back to turmeric because, like I was saying, it is one of our COX-2 inhibitors. When we're dealing with somebody coming in with severe osteoarthritic pain, joint pain, degenerative joint pain, for example, oftentimes one of our starting places is turmeric. This is different than just telling a patient to just sprinkle in a little turmeric into their soup. We're talking about kind of what I would consider a pharmaceutical dose of turmeric for a lot of our patients here when we're trying to really deal with pain management. This may be a strategy that we use post-surgically for them to help keep their swelling down as well. So these are essentially like eating pounds of turmeric. So it wouldn't be something that we can usually get through diet for people without having major GI distress. But instead, we're using an extract that's already been bioconverted and is standardized at a certain milligram dosing for the curcumin active ingredient in our turmeric, okay? We have several different forms that we use in our practice for this. We may use gel caps. We may use powdered capsules in the case of these two, or we may even use a liquid. And there's different reasons that we would do that at different times. Now, for peripheral neuropathic pain, so that's our patients who've either dealt with chemotherapy or radiation and have secondary side effects from that, from the chemo agents, or our patients with diabetes or peripheral neuropathy that may have happened from a nutrient deficiency that's now been corrected. Now, those patients often can benefit from some support for those nerve pathways. And the 3 best, according to the medical literature and what we've seen in our practice, are lion's mane, which is one of our medicinal mushrooms. Pretty cool. Here's a picture of it right here. In fact, if you live locally, you can get it fresh oftentimes from the corner store. We use extracts of this typically in our practice because we want to know what milligram patients are getting. We want to make sure it's already bioconverted so it's easy for them, no matter what's going on with their gut, to absorb that. And often we will be using B12 because we know that there's significant research about that being supportive for the mending of the nervous system. And then alpha lipoic acid is another one that has great research behind it. Not only is it an antioxidant, but it's been shown to help reduce peripheral neuropathy. We couldn't have a pain talk as naturopaths without mentioning CBDs. Now, these cannabidiols are pretty popular right now, as many of you guys have probably come across them. Now, we wanted to just kind of put out there what, from the medical world, what they're touted to do and what they've been shown to do in research. So we know that they help inhibit the triggering neurotransmitters. They also modulate the excitability of the neurons that are receiving this information. And then in the very first picture, we showed you that pain pathway. They actually inhibit some of the, they help activate these inhibitory pathways that go from the brain back down to the peripheral tissues. And then we know that they can help with reducing neural inflammation because they're antioxidants, and sleep. So there are different ways that we in our practice use CBDs. Oftentimes we'll use them internally if we're dealing with a systemic pain issue or a very strong pain issue, or if we need to help with sleep, or if there's an element of depression or anxiety, that could be an option as well. Now, remember, guys, these are THC free. These are not what we would think of when we think of standard cannabis products. These are just the CBD, just that antioxidant that's found in the cannabis plant. Now, we also will use gummies sometimes for patients. Sometimes they do better with them for dosing the milligrams they need, or if we're dealing with patients that can't, for some reason, tolerate the liquid or capsules. And then the other option that we'll use oftentimes, and many of you have probably tried for pain, is topicals. Now, not all the topical agents are the same. Some are, very effective and absorb well, and others, don't work very well at all. One of our favorites, I just put a picture of here. It's just called Level 5 Pain Relief Ointment. Very effective. It does have some camphor and menthol in there, which are also analgesics to help mitigate pain. So talking about analgesics, now these are things that work on the peripheral receptors to dull the pain pathway. There are several that we'll use with our patients. These are just a handful, but they can be very helpful when you're dealing with a certain region of your body, especially if you're dealing with musculoskeletal issues. Some of our fibromyalgia patients like these, and they use them in broader application areas. But these can be really fantastic, especially if you're dealing with getting through an injury or have had repetitive strain problems. So different kind of categories here. We have another version here of our CBDs that we use. We have one that's more specific. It has some COX-2 inhibitor components in there that are natural, that are in this topical agent. It's like a pump cream that people use for joint pain. And then there are even patches that can be used. And Dr. Mary may touch on this too when she's talking about some of the Chinese medicine stuff, but here's another analgesic that's used quite a bit to help reduce some of our pain. So I'm going to hand it over to Dr. Mary. She's going to get into nervous system support as well as the really exciting acupuncture information.
Great, thank you. Okay, so when we're talking about regulating the pain, regulating the nervous system can play a large role in that. So, we really want to kind of look at anxiety and depression, and in more moderate versions of that, anxious moods and depressed moods, and seeing how we can kind of level that out on a daily basis, and that can really affect our pain perception. So we really want to find ways to de-stress, spend time in nature, and use any mindfulness-based practices that you find are best for you. That can include meditation, long walks in the woods. We call that earthing. There have been studies that have shown um, that just being around in nature and in trees and in a natural setting can have a huge impact on anxiety and depression. So something to really think about. And then we really want to focus on activating the vagus nerve as one of our ways of kind of influencing the nervous system in the way we want to. So the vagus nerve is the parasympathetic component of the autonomic nervous system. So the autonomic nervous system means the involuntary nervous system that allows everything to function that we're not aware of on a daily basis. So our digestion and breathing and all of that, our heart pumping. And the ability to activate the vagus nerve and um, influence our nervous system in that direction can allow us to can allow us to optimize our digestive function and kind of get out of our kind of anxious in your head kind of activated state that you can often go through at work or throughout the day and get back into our rest and digest state. So some of the ways to do this are really working on stress management. Focusing on the gut can be one way. There's kind of a bi-directional relationship between the gut and the central nervous system, and just by really feeding our microbes and our gut with healthy food that it prefers is one way to address our nervous system overall. Cold exposure can be really great. If you live here, especially before it gets too cold out, going and doing some cold immersion in the sound can be kind of an extreme version of cold exposure, but can be incredibly therapeutic and kind of help break patterns of anxiety and depression and even insomnia. So definitely something to consider. And just checking with your doctor to make sure it's safe for you. We want to really focus on deep breathing. So the deep belly breathing versus the shallow rapid chest breathing can affect our nerve signaling and our ability to get into the rest and digest state. So that's another thing to really think about. Singing, humming, and chanting, can play a big role. So there's a reason why, as humans, we've been doing this for millennia, and that is, it helps with calming and bonding. And then one that I use pretty regularly is auricular acupuncture. And we'll discuss that a bit later, but there is one peripheral branch of the vagus nerve that means kind of outside of the or one branch that we can access through our skin, and that's in our ear. And so I'll often use auricular acupuncture when there's an emotional component to a physical complaint, and it can be really great for helping get patients into that rest and digest state. All right, so next I'm going to discuss acupuncture and Chinese bodywork. And this is because acupuncture plays such a huge role in my pain management cases. I really love it as a tool for all kinds of pain, and particularly for nerve-based pain. So just kind of a brief introduction to the acupuncture meridians here. On the right, you can see that there are points distributed throughout the body, and over many years, practitioners have arranged them into these lines of connection. And there are theories that they're based on fascial lines, so based on our kind of the lines that are created by the collagen networks in our body. And typically, the sort of pain and tenderness on one part of that meridian will kind of relay or relate to pain and tenderness further down that meridian. So each point has a really specific indication from a Chinese medicine theory perspective. So when I'm doing acupuncture, I'm often working with the specific location of where the pain is, and whether if that's in a muscle group, I'm working on that muscle group. If it's around a nerve or a nerve impingement, I'm working around the nerve. And then I'm also working within Chinese medicine theory to help balance yin and yang in the organs. And there's a kind of complex um, body of knowledge that whereby we have specific points that we use in different parts of the body to affect that. So acupuncture itself involves using needles at specific points to move qi and blood from a Chinese medicine perspective and affect the function of our internal organs, and largely to relieve pain. The needles are very small, and sometimes when they're very, very small, you can't really feel them at all. And sometimes they're larger and you can feel them to some extent. And sometimes that's important to be able to feel it. Um, so there are some theories on how acupuncture relieves pain. And so they've shown with clinical trials that the activation of certain points will lead to the release of endogenous or opioids and endorphins that we produce in our own bodies. And that is really very helpful for pain management. I think we were discussing before, the opioids and endorphins are some of those chemicals that will dampen that pain response. And then we also are working with nerves. A lot of the acupuncture meridians will follow nerves if you look at where they lay out in the internal structures, and then fascia, or that collagen network that is kind of constantly forming and reforming on a molecular level within us to respond to stressors in our body. And they've done molecular studies where they've shown that when you insert a needle, our collagen fibers will actually respond and start to kind of curl around the needle. So they're, our bodies are responding actively on a very kind of small molecular level to the needles in that way. So one of the things that I'll often do with acupuncture is trigger point release. So you may have had the experience where there is a muscle, say in your upper trapezius here, and you press this point and you can feel a radiation of pain up into your head and down into your chest. That's called a trigger point, when there's one point that triggers pain in many different places. And by using, and often those trigger points are acupuncture points. So by using a needle in those points and stimulating it, it can kind of cause this intense sensation at first, but eventually kind of working with the nervous system, it allows it to slow that response, and to allow the muscle to release. So that's one technique that I use a lot when it comes to musculoskeletal pain. So here, some of the major indications and reasons I'm using acupuncture are for low back pain, neck pain, arthritis, whether that's osteoarthritis or inflammatory arthritis. Peripheral neuropathy is huge. So that's one where people will experience numbness and tingling in their feet and hands. And for this, I find acupuncture to be very effective and will often kind of provide relief for increasing periods of time after a few sessions. And I find the best relief when I use a form called electroacupuncture, where we're using a small electrical stimulus at the needle that's very, kind of, you kind of just feel this buzzing sensation. And that's working to kind of provide an alternate sort of stimulus to the peripheral nerves to kind of affect the pain response over time. I'll often use this for things like muscle spasms and nerve pain from various systemic conditions. Essentially, it's really great for pain management, and there's a lot of specific ways we use acupuncture for different types of pain. So some other methods that I really like to use in addition to acupuncture, pretty much whenever anyone comes to see me, I'm using acupuncture plus some other kind of modality, whether it's acupressure, massage, and cupping, or gua sha, which I'll explain in a moment. And so this kind of can help once I'm kind of working with the nerves and the fascia. I like to use cupping and massage to help kind of remove that energy, that chi that we were working with. And so cupping is one of my favorite techniques, and it can be really great for long-standing chronic tension. So I've had many patients describe it as they feel like they're being attacked by an octopus, or, another thing to think about is it's a backwards massage. So you have, it involves the use of suction on the back usually. And, with that combined with oil, we're really using that to break up fascia between muscle bellies and kind of improve blood flow to the region to relieve tension and pain. And then acupressure is a form of massage that we're working along meridian lines and kind of using Chinese medicine theory to inform the massage itself. And then lastly, we'll use a tool called gua sha, which is traditionally a porcelain spoon. And it's a scraping technique on the skin, which doesn't sound pleasant, but patients really like it when they have significant tension. And it's just another technique of breaking up fascia and providing pain relief. And Dr. Molly did mention the topical analgesics before. They're especially some of the Chinese medicine formulas can be really, really great for helping relieve pain. And it's amazing because you can use it on a daily basis and not tax your liver and kidneys like you are with NSAIDs. And there's some really great products we have, including Posamon oil and Pain Terminator, that we're selling in the dispensary now. And I often will use that in treatment and recommend that to patients. And they all contain menthol and then Chinese herbs to move qi and blood.
Thank you, Dr. Mary. So we want to just take a moment as we're wrapping up to invite you guys to our next talk, which is going to be on thyroid, natural thyroid support. So that'll be November 8th. So make sure to look for the registration of that. That'll be on the website, as will the video of this, if you want to refer back to it. And we also want to make sure we have time to take questions here. So if anyone has questions, you can put them in the chat and we'll address them. And then I have one for you, Dr. Mary. I'm just wondering, will you touch on acupuncture in regards to, I have a lot of patients who are nervous to get it because they're worried about the needles hurting. And then same thing with cupping. Will you just touch on that, like as far as how it feels, just so people kind of have an understanding?
Yeah, that's a great question. So, when it comes to acupuncture and people's sensitivity to it, it can really vary. So, I really like to kind of check in about what, some people love deep tissue massage and the intensity, and some people just need a much more gentle approach. And so, the nice thing about acupuncture is we have different sized needles that can really kind of be we can use different sizes to kind of address someone's sensitivity. So on a really sensitive person, a very, very tiny needle that most people can barely feel will be more effective versus on a less sensitive person, we can use larger needles. And it'll kind of have a similar effect in their nervous system. So typically what you'll experience is some sensation when the needle goes in, and then it pretty much is not perceptible for most of the time. I often will say I like patients to experience a heavy sensation with the needle, like there's, someone is pressing on a point and kind of massaging an area of tension, and that can be kind of a relieving sense of heaviness. But and we'll always adjust it if there's other sensations that pop up. But it's a great question because I think the idea of needles can be really scary, but the vast majority of people are, kind of surprised that they barely feel the needles at all.
I was really surprised when I first got it back in med school, and I remember feeling like that can't be a needle. It feels like the back of a spoon is resting. So it was like that heavy but gentle pressure,
Mhm.
just kind of really made a made a difference in my mind about my initial perception of what it was going to be like. So.
Yeah.
We'd love it if you guys need us. We're here. Please give us a call and we'll get you scheduled for a consultation or an appointment to chat with us. And we'd really like to help you guys with managing pain if it's an issue for you. So thank you so much for spending your time with us today. I don't see any other questions. So I think we'll sign